Okay, what is shingles? Shingles is a viral infection that causes painful rash, and usually it's the coming back of chickenpox. And it can occur anywhere in your body. Usually it shows on one side of your body, usually in one specific area, or what we call dermatome. It typically looks like a single stripe of blister that wraps around the left or the right side of your torso. A shingle rash starts as a cluster of small bumps. The blister usually dry out and crust over within 7 to 10 days and disappear completely in about 2 to 4 weeks. In most healthy people, the blister leave no scars and the pain and itching usually goes away. But people with a weakened or immune system may develop shingle blister that do not heal in a timely manner. Shingles is not life-threatening, but it can cause prolonged pain, which is most common complication is the post-herpetic neuralgia. And we'll discuss this later on. Most people who get shingles only have it once, but it can come back, usually in people with a weakened immune system. Here in the illustration, shingles caused by the varicella zoster virus, the same virus that caused chickenpox. After you had chickenpox, the virus stay in your body for the rest of your life. It never goes away. Years later, the virus may reactivate as shingles. When the varicella zoster virus gets into your body, the first problem it causes is chickenpox. You may think of it as a childhood disease, but adults can get it too. Now, after the chickenpox run its course, the virus moves into your nerve tissues near your spinal cord and brain, where it stays. Sometimes years later, the virus wakes up and travels along the nerve fibers to your skin. That's when it causes shingles, also called herpes zoster. The reason for shingles is not clear. It may be due to lowered immunity to infection as people get older. Shingles is more common in older adults or in people with a weakened immune system. Diagnosis, to diagnose shingles is typical presentation where you'll have blister or pain in one side of your body along the dermatomal pattern. And if the diagnosis is confusing, you can do a aspiration of the blister and do a shank test called or shank smear, where if you see a multinucleated giant cells under the microscope, and that will be considered positive test. Other tests include blood tests for antigen or molecular studies. Symptoms of shingles include stabbing or shooting pain, itching, numbness, or burning, tingling, feeling under your skin. Of course, you'll see the blisters. Sensitivity to touch, fatigue, usually a red rash that begins a few days after the pain. And of course, the fluid-filled blisters. Sometimes you'll have a fever, headache, and sensitivity to light. Is shingles contagious? Yes. You can spread the varicella zoster virus to people who never had the chickenpox and never been vaccinated. You're contagious until all the sores have crusted. So keep a shingle rash covered. Until then, avoid also pregnant women who may not have the chickenpox or nor the vaccine, or people with a weakened immune system like cancer patient receiving chemotherapy and also newborns. Shingles is highly contagious, can be spread person to person through the respiratory route. Also, a person with shingle can pass the virus to anyone who is immune to chickenpox. This usually occurs through a direct contact with open sores of the rash, and once infected with the person will develop chickenpox rather than shingles. Risk factors including uh, age 50 and above, those who have previous chickenpox, those with long-term stress or trauma, those with weakened immune system, and those receiving cancer treatment, and also those receiving medication like steroids. Now, the complications of chickenpox, the most common, meaning herpes zoster or shingles, the most common complication is the post-herpetic neuralgia. For some people, shingle pain can continue long after the blisters have cleared. It occurs when the damaged nerve fiber sends confused and exaggerated messages of pain from your skin to your brain. The pain and blisters can persist for months and even years, leading to possible nerve damage and scarring. Sometimes it can cause also encephalitis, pneumonia, or even retinitis, which can lead to vision loss. Treatment we use for shingles to shorten the duration of the virus are antiviral like acyclovir, famciclovir, or valacyclovir, also known as Valtrex. Valtrex, usually we give it 1 gram 3 times a day for 7 to 10 days. The acyclovir is 800 milligram 4 times a day times 7 to 10 days, and famciclovir 500 milligram 3 times a day for 7 to 10 days. Treatment for post-herpetic neuralgia, we usually can start with NSAIDs like ibuprofen or naproxen, but if it is severe pain, you can use narcotics like oxycodone or morphine. And you can also use capsaicin cream or topical patch, and even numbing agents like lidocaine patch. And others you can use cool compresses, but the most commonly used medication is gabapentin, which is anticonvulsant. And you can also use a tricyclic antidepressant agent like nortriptyline or amitriptyline. Others use injection like corticosteroids or local anesthesia. You can also use home care for shingles, like colloidal ointment baths are effective for relieving the itching caused by shingles. And sometimes to speed up the drying of the blister, you try placing a cool, damp washcloth on the rash. Cool compresses too can help. And you should do some light exercises if you're feeling better, but you have to eat well, get plenty of rest and naps. Prevention, we recommend a vaccine called Shingrix. It's given in 2 doses, and it's usually 2 to 6 months apart. And it can offer protection for more than 5 years. And you have to see your doctors if you want to be vaccinated for chickenpox. Those people who should not get the vaccine are the one who had developed severe allergic reaction to the vaccine, or if you have shingles right now, you should not get the vaccine. If you're sick with a fever of 101 or higher, then you cannot get the vaccine. And lastly, those who are pregnant or breastfeeding. All right, thank you very much.